Hello guys, welcome to the 13th part of our RRB important MCQ series. So till now we have completed our 12 parts in which we have discussed many different MCQs which have been previously asked in the RRB examination. So we are going to carry forward this series and let's see what are the questions in the part 13. So the first question in the part 13 is, which of the following drug is not used as a catheter directed thrombolytic agent? So which one is not used as a catheter diuretic thrombolytic agent? So option A is clopidogrel, option B is urokinase, option C is streptokinase, option D is tissue plasminogen activator. So see here, catheter directed thrombolytic agents are like the name suggests, they are thrombolytic agents, like they break the thrombus present in the catheter. But in the given options, the clopidogrel is not a thrombolytic agent. It is an antiplatelet agent. So this is the odd one out here, and this will be the answer. So let's see the explanation. Clopidogrel is an antiplatelet drug, not a thrombolytic agent. Urokinase, streptokinase, and TPA dissolve clots, and they are used. Here is also an important trick through which you can also remember thrombolytic drugs. The trick is Surat, like the city in India. Here S stands for streptokinase, U stands for urokinase, R for retinoplase, A for altplase, and T for tenecteplase. So moving to the second question. Here the question says a 20% decrease in fiber bundle volume results in drop in dialyzer clearance. So 20% fiber bundle volume has been decreased. So he is asking how much clearance is going to be affected from here. So the general guideline suggests that when there is 20% decrease in fiber bundle, clearance decreases by 10%. So answer will be B. A clinical guideline and finding in dialysis literature says that 20% decrease in FBV corresponds to roughly 10% decrease in solute clearance. Moving ahead, next question says, which of the following complication in venous blood cause cherry color? So cherry color here is the key word, and we know cherry color is related to option A is aneurysm, option B is hemolysis, option C is air embolism, option D is dialysis disequilibrium syndrome, that is DDS. But the key word here is cherry color, and cherry color is related to hemolysis. So hemolysis releases free hemoglobins into blood, causing bright cherry red discoloration in venous line. So when the RBCs break down, they release HB and it causes bright cherry red discoloration. Moving ahead to the fourth question, it says the following are synthetic membranes used for hemodialysis except. So here polyamide, AN69, polymethyl methylacrylate, and hemopane are the given options. So polyamide is a synthetic membrane, we know it. AN69 is also synthetic. Polymethyl methylacrylate is also, but hemopane is not purely a synthetic membrane. So answer will be D. So hemopane is modified cellulose membrane, not synthetic, while the rest are. Moving to the fifth question, it says the standard concentration of formalin used for disinfection of dialyzer is. Option A is 1%, option B is 8%, option C is 9%, option D is 4%. So the right answer is 4%. So standard dialyzer reprocessing uses 4% formalin solution for effective disinfection. Moving to the next question, it says solutions used in molecular adsorbent recirculating system, that is MARS. So is 600 ml of 20% salt free albumin, 300 ml 5% salt free albumin, 600 ml of 10% salt free albumin, and 300 ml of 20% salt free albumin. So before you do this question, if you don't know about this topic much, I have made a dedicated video on this, so you can also watch that. And moving to the right answer, so it will be 600 ml of 10% salt free albumin here. Mars adsorbent. So Mars system uses around 600 ml of 10% albumin to remove albumin bound toxins. Moving to the seventh question here, it says, what is an example of non-biodegradable waste? So vegetables are biodegradable, wool is biodegradable, plant is biodegradable, but plastic are in the category of non-biodegradable. So moving to the next question, here the question says, when no more solute can be dissolved in a solution at a given temperature, it is called dash. So no more solute now is getting dissolved in a solution. So what will we call? So option A is saturated solution, option B is permanent solution, option C is unsaturated solution, option D is colloidal solution. This question is from the very basic science, and the right answer will be saturated solution. It is now saturated and we cannot mix anything else. So solution that cannot dissolve more solute at a given temperature is called saturated solution. Solution that contains maximum amount of dissolved solute at a given temperature is known as saturated solution. Moving ahead to the ninth question here, it says a high efficiency dialyzer has a KOA solute cutoff for urea. Option A is more than 800 ml per minute. Option B is less than 10 ml per minute. Option C is less than 400 ml per minute, and option D is more than 20 ml per hour. So the right answer here will be more than 800 ml per minute. So high efficiency dialyzer have a KOA for urea more than 800 ml per minute, indicating high solute clearance. High efficiency dialyzer we are talking about. Moving to the next question, it says which factor does not affect GFR, glomerular filtration rate, is not affected by which factor out of the following? Option A is oxytocin, option B is oncotic pressure, option C is hydrostatic pressure, option D is renal blood flow. So these all affect the GFR, but oxytocin does not, because it is not directly involved in GFR. So GFR depends on renal blood flow, hydrostatic pressure and oncotic pressure, but there is no role of oxytocin in GFR. So this was all about the part 13th of our RRB series. Hope you are enjoying this series, and make sure you practice all the questions, and the practice sheet will be available in our Telegram group. So make sure you solve this question again, because mostly the questions that have been asked in RRB comes from the same pattern or around these questions. So make sure you revise them. Thank you. Hope this video was helpful. Thank you. Have a nice day.